During the government shutdown, one of the chief claims that Republicans are making is that Democrats are trying to give free health care to undocumented immigrants, including in emergency rooms across the country.
If you're an American citizen, you've been to a hospital in the last few years, you probably noticed that wait times are especially large, and very often somebody who's there in the emergency room waiting is an illegal alien, very often a person who can't even speak English. Why do those people get healthcare benefits at hospitals paid for by American citizens?
Now, federal law expressly prohibits undocumented people from receiving healthcare benefits. But what the vice president is referencing there is a pretty complicated part of health law that dates back to 1986 during the Reagan administration, the Emergency Medical Treatment and Labor Act. That policy requires any hospital that receives Medicare funding to treat anyone who comes into an emergency room, regardless of immigration status or ability to pay. Now, one of the reasons for this is that if someone comes to the emergency room with life-threatening injuries, they need to be stabilized immediately. And if the hospital were to withhold care to check for their immigration status, they could die. In other words, the law protects Americans, but in the process, some undocumented people invariably end up getting medical care. So what does the White House think should happen when they come to an emergency room? Should ERs check for immigration status before treating a dying patient?
That's probably not a question for me to answer. I think that's a question for healthcare professionals. There were higher wait times at hospitals under the Biden administration. We saw these illegals committing crimes all over our country, and they're getting things for free. That is fundamentally unfair, and this administration is not going to support it.
Should ERs, if a person comes in with a stroke or a bullet wound or is bleeding out, should they ask for immigration status before treating that person?
Gabe, I don't speak for emergency rooms across the country.
Administration officials have long said that one of the benefits of their mass deportation program is that it would lessen the burden on the U.S. healthcare system.